Hi, everyone. It's Dr. Christine Moutier here, and I'm excited to talk to you all for the next bit of time about how to take care of our mental health during this period of coronavirus. And myself, I am Christine Moutier, and I serve as the Chief Medical Officer at the American Foundation for Suicide Prevention. And we're really excited right now to be partnering with Now This to address the topic of mental health and our own resilience and thriving during this period of time. So first, I want to just tell you a little bit about the American Foundation for Suicide Prevention, so you know where it is that we're coming from and what we do in the world. So AFSP is the leading nonprofit organization, we say, fighting suicide in the United States. And we do that through funding research and translating that research into knowledge so that everyone will know what their role is to play in preventing suicide. And we're really fortunate to have an incredible chapter network of AFSP chapters who are all basically individuals like us who are either interested in preventing suicide, and mostly where we have actually been personally touched by mental health and suicide in some way in our personal lives and in our professional lives as well, many of us. And we also advocate for policy change at the federal and the state level, everything related to mental health parity, to what needs to happen at the state level for workplaces, schools, training, so that we can basically reduce the nation's suicide rate, and so that people who have experienced loss or our own lived experience, meaning our own personal struggles of mental health experiences or living through a suicide attempt, so that we can live in a world that understands that people like us deserve compassion and appropriate treatment in health settings, for example, but also fairness in other types of situations like school and work. So that's just a little bit about what we do at AFSP. And you know, today I'm really excited to be here talking to you about what we are seeing and what we can all do to thrive better and to encourage those around us to take care of their mental health. Right now is obviously such an unprecedented time in so many different ways. And it affects people in different ways, depending on your circumstances. If you're alone and having to basically quarantine on your own, or if you are staying safe and, you know, practicing physical distancing, that's what I call it, instead of social distancing, practicing that distancing with a family, or if you have a network to reach out to. It depends on if you've lost your job right now, if you're able to continue working remotely. And so, and economically, it's affecting all of us in different ways as well. So obviously, it's not just a one size fits all, but the thing that is pretty certain is that our lives almost across the board have been impacted in some way. And there actually is a little bit of data now that's coming out through various polls that, for example, the American Psychiatric Association and the Kaiser Family Foundation, the Pew Research Trust firm, all of those are conducting polls on an ongoing basis, trying to kind of take the temperature of the American public. And what we know is that anxiety is running high right now. And so it's, depending on which survey you look at, it's about half of American adults right now that say that the coronavirus is impacting either their anxiety level, their sleep, or their mental health in some way. And it's about 20% of American adults who say that their mental health is being impacted in a more serious way. So I wanted to just speak to that very briefly before we get into the questions that many of you submitted ahead of time, and thank you again for that. So again, thinking about the fact that we're all different, we have different circumstances. Some of us have mental health conditions at baseline that we already manage and have practice at managing. And some of us may not have thought much about mental health before at all. But now you're finding that different things about your life are actually being affected. And so what I want to say is that for all of us, just like we have our physical health that we live with and we manage, whether we have a physical health condition or not, the same thing is true for our mental health. We all have it. And mental health is dynamic, meaning it can change over time, day by day, depending on the stress level in our life and depending on some of the choices that we're making, as far as not only stress management, but the health of our relationships, what's going on at work, but also biological and chemical things, what we're taking into our body. If we're dealing with physical illness, that can affect our mental health, for example. And if we're drinking or using, and if we're treating other aspects of our health, all of that interplays into our mental health. And if you think about it, just like, let's pick the example of heart disease or heart health, cardiovascular health. We all have the physical organ of our heart in our bodies, just like we have the physical organ of the brain in our bodies. And that organ is hopefully remaining as healthy as possible because we've learned how to protect it by behaving in certain ways and practicing certain patterns. And it turns out that some of the same health forming habits for your heart actually will also keep your brain healthy and vice versa. So some of those real basic things right now that all of us can possibly shore up both our physical and our mental health right now by practicing are things like protecting our sleep, making sure that we are getting the right kind of nutrition, at least some regular exercise. And I know that can be hard right now. All of these things can be harder because we're not in our usual ways of how we get exercise or how we get our food. Making sure we stay hydrated with water, even more so than normal, and limiting your alcohol intake. Those are like the most basic basics for any aspect of your health. You can be pretty sure that there's research that shows that those 5 things will lead to different and better outcomes related to your health. And that certainly is true for our mental health and our thriving and our resilience. But there's some other basic things that are true for all of us as human beings that are just by nature of the way we're wired as humans. So for example, we are extremely social creatures, all of us. And so keeping some level of social connection during this time is really critically important, especially because of the physical distancing practices that we need to be doing because of the virus. And what I would say is get as creative as you can about that. It's almost like the usual rules that apply for social norms kind of are out the window in a good way. Like we can try some new things and reach out to people that you feel allow you to be your healthiest and most grounded self. So where you are able to exert some decision-making and control over your own environment and over who you let in right now, though now is the time for that, because we really all need to be figuring out how to thrive. It's sort of like day by day and week by week. I myself am having to figure it out as well. The other thing that is pretty basic for all of us is that we respond well to some degree of structure and some degree of a plan and routine. So especially now, if you've been laid off, or if you're working remotely, or if you're trying to do school online or remotely, it can be tempting to just kind of let your sleep habits fall where they may, and figure you'll be able to get everything done, later on. But it's actually now more than ever is the time to get out. I'm old fashioned. I like paper and pencil, like a calendar or a weekly planner, and actually get out and write down your plan. When are you going to sleep? When are you going to eat? When are you going to work? And when are you going to, or work or school? And when are you going to be connecting with others? And exercise as well. So those are the things that I do like on an ongoing basis during normal periods of life, let alone at a time like now. I'm finding that with my own family members, we'll kind of go over the plan for the weekend or for the week in advance, and it helps everyone to know kind of what's happening. So structure and routine is really important. And if you have children at home or in your lives, they, like adults, really need structure and routine as well. And so helping them to know what's happening, how their day is going to lay out, and that they will have opportunities to connect with friends and family members who aren't in the home, because you're going to find a way to make that possible through virtual, play dates or meals and things like that with grandparents and things like that. So let me just think if there's anything else that I want to say. I guess one of the main things before I get to questions is that while there is so much suffering and hardship going on, and for some people more so than others, there is also the potential that we could create some new patterns as a society that relate to, for example, connecting with each other. If we come out of this with a more sure sense of how much we need to shape our relationships and our communications in ways that encourage one another, and create positive health for both parties, that will be a major win that we come through with that as more of a strong core value in our society. If we come out of this with the ability to access mental health care through greater availability through telehealth and virtual meetings and video conference types of evaluation and treatment and therapy and even medication evaluation, all of that could happen through telehealth. That will be a win, because there is research to show that virtual telemedicine can be as effective as in-person evaluation and treatment for many different clinical conditions, not just within the mental health arena. So if you've been following the news, you've seen that the federal government has allowed for a way that is now being offered by healthcare providers and clinical systems like never before, because there used to be laws in place that actually made it very difficult, even for health providers who wanted to provide telemedicine services. So we are very pleased that those restrictions have been loosened, and that may last long beyond the coronavirus period of time. So maybe I'll come to this feeling of hope, wearing my hope shirt for AFSP today, that there are reasons to hope, not only for ourselves as individuals and for our families, but for this societal takeaways, that we may have some learnings and some new things that we move forward into our future with. Okay, so let's see. With that, I'm going to go ahead and again, thank the individuals who put these questions forward previously, and I'm just going to go through several of them. Okay, the first one is, what's the best way for me to reach out to check on someone's mental health? Internet, phone call, question mark. Okay, so this is great. And at AFSP, we have a program called Talk Saves Lives. And it basically is a message that says all of us are in a position to be able to notice if someone in your life might be struggling, because you probably have some gut instincts about what their normal behavior patterns look like, what we think of as personality. When people start to come across in different ways that don't seem themselves, oftentimes that can be the tip of the iceberg, because we are so socialized to keep our suffering and our distress under wraps. And so, but it tends to leak out in some different ways through our behavior. So I'm so glad that somebody's asking about, what is the best way to check on someone? I think it's very much like we normally recommend at AFSP. What we normally say is, number one, assume you're the only one who's going to reach out. So try not to avoid doing it, because we've long practiced in many ways to rationalize that, oh, it's not my job, I'll insult the person, maybe they're just having a bad day, I'll just kind of leave it alone and wait and watch. And the truth is, this could be a really important moment where even if they aren't struggling in a severe way, you're checking in on them and expressing caring concern is a way that they can feel your support and can shore up their own sense of being cared for, which for somebody who is struggling with their mental health can make all the difference in the world. So I think it depends, this question, like how to do it, I think it depends on your usual baseline relationship with that person. If it's someone that you know pretty well, I would absolutely use the phone or text, however you normally do a reach out. And what I like to do when I'm going to have this kind of caring conversation is to set it up in a special way, so that you're not just like, oh, hey, by the way, in passing, but you're actually saying, do you have a little bit of time to spend with me? Because I wanted to meet with you or speak with you. And so this might be setting up a FaceTime conversation or a phone call. And, of course, being on the receiving end of that, if you were the one being reached out to, you're wondering, oh my goodness, what's going on? Have I done something? Am I in trouble? Many of us go to that space. And so when you start the conversation, it's important to say, I'm reaching out because I noticed, and I say exactly what I noticed, and that I'm doing this because I care about you, and I want to make sure that you're okay. I want to actually learn more about what it is you might be going through. And you can just leave it very open-ended. And if they're ready to talk and share, and they do, your main job is to just sit quietly and listen, and through the ways that you know how to be engaged in active listening, use those skills to say, I think I hear what you're saying, reflect back some of their words, make sure that you have it. And so that's the way we recommend having that kind of caring, supportive conversation. It may be, again, very important for you to say more than once that I'm having this conversation simply because I care about you and I want to support you. And I really want to understand more about you and what you're going through in life right now, if there is something going on. So those are just some ideas about how you might set up a conversation like that. Okay, second question. Oh, well, I kind of covered this. How do I even start that conversation, right? Because really getting it started is the hardest. Just think about when you're on the receiving end of a caring expression where someone is actually taking the time to check in with you, you actually feel cared about. And you feel supported and heard in a way that somehow lessens your burden, even if the same exact stressors, you don't even have to get to the problem-solving place to really feel that level of caring. So I think just remember that truth when you're the one thinking about doing the reach out and you're nervous because you're not sure, maybe you haven't taken it to that level of depth before in the relationship. Just remember that people generally are all the same. We respond to the love and care of others and just the interest of others, as long as we don't feel judged and criticized. And so that's why sometimes it's important to say that right up front. Okay, next question. How do I make sure I'm using the right words and being mindful of the phrases regarding mental health? Okay, that's a great question. what I would say is, number one, you do not have to use perfect language. If your motivation is one of caring and support, and you say that, that's enough to give you the sort of grace to be able to like use words that might not make as much sense. It really doesn't matter. What matters most is that you, when I'm asking someone, when I'm really thinking about their mental health, I may not use the words mental health right up front. I may couch this as, I'm interested in learning more about how you're doing. And if you're going through anything, what's happening? What is that like for you? And so it's really talking about just their experience as a human being. And as people in our lives, what happens for us is that when we're experiencing a mental health worsening and loneliness, depression, fear, anxiety, it's not happening in a vacuum. It's happening in the space of our lives, our relationship, the stressors we're going through. And so it's always going to be tied to the story of our life in that moment. And so it is completely not only okay, but the right thing to do if you're checking on someone's mental health, to really be asking them how they're doing in general. How are they feeling in their life, in their relationships, at work? But if they keep it, oh, it's all fine. If they're not really opening up much, you could then just take it to the next level by saying, I'm actually interested also in how it might be impacting you. Really alluding to the person's internal experience of those external events that are happening in their relationships or their work or their school or their home setting. So, if they do start talking about, well, I've been feeling, overwhelmed, or really like I'm losing my temper more, I feel more on edge or irritable. All of those might be the person's language, and very appropriately used language, for the fact that their mood, their anxiety level, their well-being is being affected. And it's fine to focus on what the source of that influence is, but it's also important to take it to the place of helping them to identify that it is affecting them in some ways, and that you're there with them, you're there for them. That's really your main job. You don't have to be, again, a mental health professional that says, well, you can do something about that, or there's a solution I have in mind. Those are all fine if they're done telling you about their situation and they want to have some solutions in mind. Sometimes people just need to be heard. And so I would be careful at least about jumping in too quickly with the solution kind of oriented stuff. Try to think if there are any other kind of helpful phrases. Mainly it's about like active listening skills and just reflecting back to them. Did I have that right? If you want to take it a little bit deeper and you're really starting to worry based on what they're telling you, what I would usually do is I would say, when you talk about and use their language, when you talk about so and so and that it made you feel bullied or overwhelmed, I'm picking up on that it might really be distressing to you. So it would be fine if you're feeling like they're overwhelmed, they might be hopeless, they're despairing, they don't see a way through. It is absolutely fine and actually a good thing to ask them if they ever have thoughts about ending their life. Because the way that I ask the question is I say, when you talk about such and such, it sounds like you're feeling incredibly overwhelmed by that. I'm wondering if in those moments or in any other times recently, if you've been thinking of ending your life. Just leave it right there and let them talk. And if they say that they have, understand that in any population right now, at any given time, there are people who are having suicidal thoughts who are not about to act on them. So it's not a moment that you need to like drop the phone and call 911. You keep listening to them. You keep caring for them, trying to understand how that is for them, and offering your support, your love, and your caring. Now, if somebody is having suicidal thoughts, then it certainly would be appropriate to link them up with either the National Suicide Prevention Lifeline or the Crisis Text Line. Those are our two main national resources that we trust and we know are there for people anywhere in the United States. But what I will say is that right now, during coronavirus, there is not at all a foregone conclusion that suicide risk for people is on the rise. That is, number one, not what we're seeing. In a conversation that I'm having ongoing with those two resources, while the volume of anxiety, people feeling anxious and calling or texting the crisis text line is up, it is not about them feeling suicidal. And so, again, I want to make sure that everyone understands that this human response we're all having to this stressful period is, number one, very understandable, but number two, something that we can help ourselves and help each other with just by being a supportive community and by practicing those self-care skills that I had mentioned earlier. Okay, I think we probably have time for one more question. How do you suggest resources to someone, and how do I know that resources are legitimate if I'm looking for resources? So in that caring conversation that you're having, what I would suggest is after you've finished listening and it's kind of, you're in more of the wrap-up mode, especially if you're somebody who has struggled yourself before, if you've ever been to therapy, if you've ever needed to lean on someone for support, of course, hopefully all of us have. That would be a normal, healthy thing as humans for us all to have done several of those things. That you can share that you've been somebody who has leaned on these types of resources before and you have benefited from them. And you can go to afsp.org to find all of the resources for finding help, either for in a crisis or just for how to find a mental health professional, for example, right now. Last thing I'll say before wrapping up is, if you're wondering if you could actually get therapy through a telehealth service, if you have insurance, the best thing to do is to go on your insurance webpage or call your insurance and ask them if that's something that they're offering. Many, many companies are now making that available if they didn't already. So I would encourage everyone to think about that. Well, I think our time is coming to an end for this session. And I want to thank everyone for tuning in and participating and making comments and asking questions. That's really terrific, for encouraging each other. And I do realize that there are probably many questions that we were not able to get to today. And so please check on both AFSP's as well as Now This's Facebook page for the next time that we might do this again, either later this week or next week. So I will end there and wish everybody a great rest of your day and your week, and encourage each of us to maybe try something new in your own self-care practices and see how that goes for you. All right, thanks so much, everybody. Take care. Bye.